If someone told you that after the first 3 months breastfeeding gets easier, they lied. Well, they didn't exactly lie, but they didn't definitely didn't tell you the whole truth. While some things do get easier, there's a whole new set of challenges that await you, and they blindside you when you think everything's going great. I'm Jen, I'm nurse practitioner, IBCLC, and I'm here to walk you through those challenging steps in the breastfeeding problems that nobody tells you about when your baby hits 3 to 4 months. Most breastfeeding classes focus on those challenging first few weeks, and rightfully so. Those are hard. But what happens when you've worked through the initial hurdles? You think you've got your groove, and then all of a sudden, new issues pop up. These later changes can be especially frustrating because you feel like you should have figured this out by now, and there's less support available because everyone assumes you're past the hard part. One of the most distressing issues I see is the sudden nursing strike that can happen around 3 to 4 months. Your baby was nursing beautifully, and then seemingly out of nowhere, they start refusing the breast, pulling off, crying, seeming frustrated every time you nurse. This isn't your baby weaning. Babies rarely wean themselves before 12 months. What's happening is developmental. Around this time, babies become much more aware of their environment. They have FOMO. They're easily distracted by sights, sounds, movement. Their nervous system is also maturing, which can make them more sensitive to changes in milk flow. The common triggers include oversupply, causing fast milk letdown, milk supply changes due to hormonal shifts if your period is coming, babies' increased awareness, making them more distractible, growth spurts creating temporary supply and demand mismatches, teething discomfort starting early, earliest is 4 months, and the key is not to panic or assume your breastfeeding journey is over. It's usually temporary and manageable. Here's something that shocked me even as a lactation consultant. Your milk supply isn't static after those first few months. Many parents think once the supply is established, it stays consistent, but that's rarely true. Let's cover it. First up, hormone shifts. If you haven't started your period yet, when it returns, you might notice your supply dips. In the days leading up to it, your hormones fluctuate, and it's completely normal and usually temporary. Second, growth spurts. These don't stop after the newborn phase. Growth spurts typically happen between 3 months, 6 months, and 9 months. And each one can temporarily throw off your supply-demand mismatch and their balance because they want more and they've got to create more by cluster feeding and getting mad at you. Increased efficiency. This one's tricky because it can feel like a problem when it's actually positive. Your baby becomes much more efficient at nursing and they empty the breast faster. Your breast might feel less full. You might pump less, but your baby's getting what they need more efficiently. The next one is the low milk supply perception. Around 3 to 4 months, many parents worry that their supply has dropped because your breast feels softer. They're not leaking as much. You aren't feeling that typical fullness that you did in the early days, and you're not pumping as much. Usually this is just your body regulating and becoming more efficient. Research shows that most perceived supply issues after month 3 are actually normal adjustments and not a true milk supply issue. The next one is the distracted baby. Around 3 to 4 months, many babies become what we call distracted nursers. They'll latch on, nurse for 30 seconds, pop off, look around, try to latch again, pop off again. This is incredibly frustrating and it makes you wonder if you have enough milk and why they're doing that. This is actually a normal developmental milestone. Your baby's vision is improving, they're becoming more social, they're more aware of their environment, and they're developing better head control. So everything is more interesting than it was before. So what can you do to help your baby stay latched on? Here's a few strategies to help. Nurse in a quiet, dimly lit room during peak distraction times. When there's chaos going around, you have a toddler running around at home, you've got a husband who's just walking in the door from work, etc. Using a nursing necklace or a soft toy to keep their hands busy. Just have that necklace or that toy up where they can see it while they're nursing. Try different positions that allow them to see around while nursing. Sometimes walking around the room while you're nursing can help. Take advantage of the drowsy times. They're usually less distractible when they're drowsy and wanting to fall asleep. Don't force it. Short, frequent sessions are fine. They might just do it more often. Remember, distracted baby who's gaining weight appropriately, getting enough milk, having good diapers, even if the sessions look chaotic, are fine. Teething can also start as early as about 4 months, and it usually brings its own nursing challenges. They can become fussy at the breast because their gums are hurting. Others might bite, and yes, babies can bite, and their gums are painful because they're hard. And so what can help with that? Offer something cool to chew on. Like I like a cold washcloth that they can just kind of chew on before they nurse. Try different positions that put less pressure on the sore gums. If they bite, don't yell. That'll scare them and they'll be resistant to go back to the breast. Sometimes a teething baby nurses more for comfort, which is normal, and that's great, especially if they're already in a developmental milestone and they're growing and having that growth spurt. And pain relief as needed according to your pediatrician, if that's a little bit of Tylenol. The key is understanding that teething discomfort can last for weeks. You might think that tooth is so close because they're doing all the symptoms, and yet you never see it. Just be patient with you and your baby. What no one prepares you for is the social impact of the nurser who won't nurse well after 3 months. It becomes harder to nurse in public because your baby is more distractible. They take off the nursing cover. You feel more self-conscious as your baby gets bigger. You have more comments from family members and friends who mean well, but they might suggest you to do better with formula because you're complaining about your baby not wanting to nurse, or they suggest maybe you should be done by now. Or if you're returning to work, then sometimes that's a pressure too, because sometimes your employer has a struggle with you and your pumping schedule. If you're pumping, you might notice output changes, or your baby might start refusing bottles, creating more stress about returning to work. You also might be feeling a little touched out by now. You're overwhelmed by the constant physical demands of breastfeeding, especially if your baby's going through a clingy phase when they're having the growth development. These feelings are totally normal. They don't mean you should stop breastfeeding if you don't want to. If you need help, you should reach out to your IBCLC or healthcare provider if your nursing strike lasts more than a week. If you notice significant changes in your baby's weight gain, or you develop any new pain or discomfort with breastfeeding. If you're feeling overwhelmed or considering weaning when you don't really want to, check with your healthcare provider or IBCLC, or if your baby seems consistently frustrated at the breast. Remember, lactation support is not just for the newborn period, although that's when we see that help becoming more consistent, but we can help support you throughout your journey, no matter what it looks like and what time frame you're in. The truth is, breastfeeding is not easier after 3 months, it's just different. You're dealing with a more developmentally complex baby, changing hormones, maybe returning to work. But understanding that these challenges are normal and temporary can help you navigate them with more confidence. The most important thing is to remember that every breastfeeding relationship is different. What works for one family might not work for yours. Trust yourself, seek support when you need it, and do what you need to do. If you have a goal of making it to a certain time in your breastfeeding journey, don't let these developmental challenges deter you from your goal. We can get through them if you're patient. If you're dealing with any of these challenges right now, let me know in the comments and know that you're not alone. If this resonated with you, be sure to subscribe for more breastfeeding help and content. And if you're struggling with any of these issues, you can look at my downloads and I'll put a link below. I'll see you on the next one.